Welcome to Movement RX Weekday Mobility. I'm Dr. Teresa Larson. I am at CrossFit Elysium. It's not a trend, it's actually a revolution here. I'm here with special guest Nat Fox. She's from Australia, a tactical athlete visiting doing a mobility camp here. And we met through Dr. Kelly Starrett at Mobility WOD. So I'm going to have Nat kind of introduce kind of why she's here. She's got this pretty awesome instrument that makes really loud noises. And take it away.
Hi, I'm a saxophonist and I've been injured for the last couple of years, and I'm currently trying to basically get back into playing at a professional level. I am a professional, but I am struggling with injury. So I've been working with Teresa to try and get back into doing my high-level saxophone playing to an extent that I don't have to worry about physios or treatment and look after myself, which is a big thing for us as musicians.
What kind of injuries were you dealing with before you came here?
Initially I had a shoulder injury and I've had surgery on that. And then I had 2 discs replaced in my neck at about C6, 7 and C5, 6. Alright,
so Nat has kind of got the runaround by a lot of practitioners in where she's living, and that's kind of common sometimes with athletes that come to see us, is that they've seen a lot of their practitioners. And the biggest thing that we've done here is kind of focus on proper positions and not being scared to move, right? So obviously this nice contraption here on her neck is not ideal for the neck. So show us how you play, and go ahead and come a little closer, Brian, so you can see.
So if I'm sitting down, which is a lot of the time practicing, I'll be here, or I'll be sitting like this sometimes.
Okay, so after you get playing for a long time, what happens to your shoulders and your neck? So she starts to round here, and her neck starts to get that classic forward head posture. So the classic forward head posture, not a videographer, you're okay. The classic forward head posture is not ideal, especially when you got a band hanging off of your neck. So, and you got, how heavy is that saxophone?
About 2.5 kilos.
2.5 kilos.
I don't know what that is either.
About 5 pounds, roughly. So that's still significant weight pulling you forward. As we know, every inch forward that the neck sits on C7, T1, that's 10, 11 pounds of pressure forward on your body that's going on her neck. So she has even more pressure going forward on her neck. So what are some of the things that you learned this week about your body that you can really help you?
Basically creating stability in the hip joints and the shoulders, and just ways to be able to keep my posture up, and the right way to sit. That's the big thing. Now I'm learning how to actually sit and play efficiently and effectively.
Alright, so show us that position. So she's going to have to be very conscious of, like motor control wise, of the way she sits and how stressed out she gets when she's playing. She needs to be more relaxed. So shoulders are going to be pinned down and back. She's going to slightly tuck her chin because, again, if she just relaxes, her neck's going to want to pull forward because of the weight here. Now, what did you talk about with the breathing that was crucial that's going to help you relax?
Breathing with your diaphragm and not with your shoulders, making sure that everything's relaxed at the top. Everything needs to be very relaxed through the top, and make sure there's no excess tension in the legs.
Right, okay. So just being able to learn how to sit and create the torsion, that was one of the biggest things we talked about that week, is the torsion in the shoulders, the torsion in the hips, like how much that protects the low back, protects the upper back, and it's going to help protect her neck. Because when you get that torsion, all of that tissue on the back of your arm is wound up. And for her, she can hold that position, she's going to build stability strength there, and it's going to help protect her from getting that long creep, that creepy ligament, creepy vertebrae syndrome where discs start to slide forward, ligaments start to stretch out, and then she's got poor posture, low back pain, herniated discs in her neck, shoulder issues because she wants to, grab that dish out of the cabinet, and now she moves her shoulder because her shoulder's so far forward. So all of those things, now she's more aware of, and she's been building from. So why don't you hand me the saxophone, and I want you to show everybody. Thank you. I'm not going to blow on it, I promise. even though I really want to. Okay, show us the mow that you like to do with the barbell. So this is very similar to the first rib mow. However, she's doing it to help stretch out some of those scalings that attach to that first rib. Scalings that attach to your vertebrae in your neck that go all the way down to that first rib area. Go on the other side if you would. So this isn't her plane, this isn't the side that gets stressed the most, but what she's going to do is put the barbell right on top of her upper chop, even if she leans forward a little bit. Good. Stay nice and tight through the midline. And she's going to take her neck and side bend it away from the barbell. So right there, she's kind of getting into those tissues that can kind of clamp down on the brachial plexus and also the nerves that go into the arm, as well as decrease some of the tension that's pulling on the neck. So pretty legit mow. This is something that she was really liked. There's a bunch of other ones she's learned this week, but in a nutshell, like, the best part about the week is it's kind of opened up her capacity, would you say, to not being fearful. I really wanted to blow that. Not being fearful of your lead. So anything else you want to say about your San Diego trip and just being here?
Well, it's been a great time working here. As a professional musician, I do play 6 to 10 hours a day, and I don't get to choose when I play. So I have to play when I'm told to play. I do have outside times where I'm meant to practice, and I have performances outside of that. And I do marching and everything. Pretty much my job is physical with an instrument attached. So it's very important that I get those stable positions set.
Right.
Otherwise I fatigue, fall into those unstable positions, and then, you know, ruin the hobby aspect of it as well. Right. So it's quality of life, and it's also endurance and being able to play.
Also, and you're in San Diego, having your fun, on a vacation, a blessing. Thank you very much. We'll see you guys next week. Thank you, Nat.